But we begin with high-stakes negotiations going on tonight inside the building that is over my shoulder, the U.S. Capitol back there. A small, exclusive team of negotiators gathered behind closed doors attempting to hammer out the Senate version of the biggest change in American domestic policy since at least the Beatles, maybe even since the days of Shirley Temple and Cole Porter. Democrats in the White House have to make two Senate bills into one, which then needs to pass the Senate, which then needs to be brought to terms with what passes the House. They've still got a ways to go, in other words. But negotiations now are about what exactly Democrats want reform to be like. The opposition to health reform appears to have gone mostly silent, or at least mostly wildly off message. Take Senator Jon Kyl of Arizona, who this weekend parried a question about Americans not having health insurance by saying this.
I'm not sure that it's a fact that more and more people die because they don't have health insurance, but because they don't have health insurance, the care is not delivered in the best and most efficient way.
Actually, it is a fact that people die because of a lack of health insurance. Just last month, Harvard Medical School researchers published a landmark study of the correlation between not having insurance and dying. If you control for factors like education and income and obesity and drinking and smoking, what makes the difference in death rates among Americans? Health insurance. You're 40% more likely to die if you do not have health insurance, all other things being equal. Statistically speaking, you can blame 45,000 deaths a year in America on people not having health insurance.
I'm not sure that it's a fact that more and more people die because they don't have health insurance.
Senator Kyl grounds out to shortstop. Now, the chairman of the Republican Party, Michael Steele, then said in an interview with Univision over the weekend, quote, "I don't think we need a comprehensive overhaul of our health care system." Now, nothing was lost in translation there. Even though this was Univision, Mr. Steele was speaking English. His answers were just translated into Spanish, and his words verbatim were, "I don't think we need a comprehensive overhaul of our health care system." For all the myriad messages Republicans have tried against health reform this year, there's a reason they haven't gone with "everything's fine, leave health care alone." Mr. Steele strikes out swinging. Well, as the Republican opposition to health reform falters, the other factor to consider is what's happening outside the Republican Party in the conservative movement and in the conservative movement media. You may recall the anti-health reform activist doctor who mass emailed this horrendous image of President Obama as a witch doctor with a bone through his nose, who's also somehow a communist witch doctor with the hammer and sickle there. The activist who emailed around that racist image was a Florida doctor named David McCaleb. After Talking Points memo publicized Dr. McCaleb's circulation of that witch doctor thing, Dr. McCaleb publicly apologized, and he said at the time that he was going to withdraw from the debate over health reform. He's now back. He's now back on the Fox News channel, being cited by them as an expert on health reform.
Americans can stop this. They need to call Congress, and they can go to places like DoctorsForPatientFreedom.com. They can go to FreedomWorks.org. If hundreds of thousands of people call the senators in their own district, this government takeover of medicine will stop.
The Republican Party chairman says health care is fine the way it is. Senator Jon Kyl of Arizona says health insurance is frankly just overrated. And the Fox News channel is hosting expert commentary on health reform from the "president has a bone through his nose" racist witch doctor email guy. Ground out, strike out, knock yourself out. If this is the opposition, the chances for health reform have, from this vantage point at least, never looked better. Joining us now is Democratic Senator Sherrod Brown of Ohio. He's a member of the Senate Health, Education, Labor, and Pensions Committee. Senator Brown, thanks for coming in tonight.
Good to be here.
Good to see you.
In person, Rachel.
It's nice to have you here.
Nice to be here.
You can tell from my introduction that I believe that the opposition to health reform looks weak right now. Roll call today says the Republican strategy against reform is delay, define, and derail. How confident are you that a bill passes? A strong bill?
That's really been what it's been all along. I mean, it started with all the charges of euthanasia and all the kinds of things, killing Granny and all that. That clearly backfired. By late August, early September, I had my first big town hall meeting. I went to the most Republican conservative part of Ohio, the University of Cincinnati in Cincinnati. And even then, I could see things began to change. 2/3 of the audience of 1,500 were supportive of the bill. And then you can just see one thing after another. What Senator Kyle said, what Chairman Steele said, as you point out, that it's just been from the negotiations on. It's been, how do we slow it down? How do we stop it? It really is the party of no. It's been the party of no. It's just more evident now because it's getting more and more desperate as this bill gets closer. We're going to have a good health care bill by December to the president's desk. It's going to have a strong public option, and I feel more certain of that than other times on the show. When I've thought it all along. I think it more. I believe it more strongly now. That's what's going to happen.
The White House says that the public option is the president's preference, but that it shouldn't be fetishized, that the public option is a means to an end. It's a means to get a lot of people covered and to control costs, but you can do that other ways, too. They won't insist on a public option.
Nothing works better than a public option in terms of keeping the insurance industry honest, in terms of covering people and providing alternative competition, if you will, to in particularly underserved areas, in getting costs down. Nothing fulfills that function like a public option. I don't think the public option is the most important thing in the world in this bill. There are lots of other things that really matter, but 90% of the Democrats in the House and Senate are for the public option. 70% of doctors, according to a Robert Wood Johnson Foundation study of 3 weeks ago, are for the public option. 2-to-1 of the public, two-thirds of the public consistently all summer and fall have been for the public option. It's going to be part of the bill because as I said, the overwhelming number of Democrats in the Senate and in the House want a strong public option that really will keep the insurance industry honest.
Well, as we figure out the path between now to December, all of the legislative action on health care reform right now is happening really among Democrats. I mean, all those examples that I cited were Republicans talking on television shows because they're not really necessarily right there dealing with the negotiations right now. Are you comfortable with how the process is going and what commitments have been made by leadership in terms of what their bottom lines are?
Yeah, I think leadership will come up with a good bill to put on the Senate floor. I think we'll pass a bill with a public option. I think the House will pass a stronger bill, and then in conference committee we'll get a good solid bill with public option. It will do all the things that we care about. It'll have insurance reform. It will have universal coverage. It will have some kind of employer mandate so everybody's covered, and we will see. You know, I look at it this way, Rachel. As this goes through, I look back at the days of Medicare when people were a lot of people that voted against Medicare realized they were on the wrong side of history later, but because they voted against it. And I think more and more people are going to see this makes sense. Democrats and Republicans alike that are not quite as sure about the bills you and I are that this in fact will matter for that a year from now, 5 years from now, this will look increasingly good to the public.
I know that we're going to hear a lot from Republicans because they've telegraphed what their strategy is about Medicare cuts. There's going to be tax increases, premiums increases, and seniors are going to pay. There's going to be Medicare cuts. I talked to my 94-year-old grandmother this weekend about what she's thinking about health care reform right now. She's been enjoying the benefits of Medicare, including hospice care right now. And as a very smart, strong, connected woman, she's afraid from what she's heard that her Medicare is going to be cut. What would you say to her? What do you say to seniors who are afraid, regardless of the facts of the bill?
Well, I'd start with the people that are saying they're going to be Medicare cuts and want to act like defenders of Medicare are the same group of people, conservative Republicans, that have tried to privatize Medicare in the Gingrich days and ever since, and frankly that never supported Medicare. That group of people, the conservative wing, particularly the far right wing of the Republican Party, never supported it in the 1960s to begin with. Second, the only real cuts are going to be those overpayments to the insurance industry that the Republicans have been shoveling more money to the insurance industry to privatized form of Medicare to HMOs ever since since the early part of the Bush years. They kept increasing subsidies to insurance companies and at the same time really taking away from Medicare fee-for-service. So we're not going to continue to subsidize the insurance industry. The insurance industry is clearly overreached in the last 10 years in the entire Medicare system, let alone the rest of private insurance and the rest of our health care system. And I think that we're going to see, our party will never cut Medicare. We're the ones that supported it. Most of us want in this bill a Medicare lookalike in the public option. I mean, that really does underscore our commitment to Medicare and that kind of government-delivered health insurance.
Senator Sherrod Brown, Democrat of Ohio.
Thanks,
great to see you in person. Thank you.
My pleasure. Thanks.